The common cold is a viral infection and affects the nose, throat, sinuses, and larynx. These may include coughing, sore throat, runny nose, sneezing, headache, and fever. Most can be effectively treated at home, but if you have one that lasts longer than 2 weeks, you should see a doctor to make sure it isn't something more serious. So stick around for 19 tips to get rid of a cold. 1. Boost your immune system with extra sleep. Most adults require about 8 hours sleep per night. If you are fighting off a cold, you will probably need more. When you have a cold and you are feeling sleepy, your body's telling you what it needs. Rest will help boost your immune system and enable your body to fight the cold more effectively. 2. Drink more water. Having a runny nose or a fever causes you to lose moisture. Make sure you drink enough water so that you aren't forcing your body to deal with both the cold and dehydration. When you sleep, keep a cup of water, juice, or warm lemon water near your bed. If you are having trouble sleeping, you will be able to take a few swallows each time you wake and avoid dehydration throughout the night. Avoid coffee and alcohol, these will dehydrate you. If you are urinating infrequently or passing dark or cloudy urine, these are signs that you are dehydrated. 3. Try not to get too cold. If you are so cold that you start shivering, your body will use energy that it could be used to fight the cold virus. If you have to go out, add an extra warm layer of clothing like a big sweater. If you can stay home, add an extra blanket to your bed. Try using a hot water bottle or sipping a hot drink if you have trouble getting warm. 4. Try to ease your breathing. If you are coughing or have a stuffy nose, it can be very difficult to sleep at night. Try keeping the air in your bedroom moist with a humidifier. The better you sleep, the more energy you will have to fight off the virus. If you don't have a humidifier, you can easily make one. Put a pot of warm water on the radiator and let it slowly evaporate overnight. 5. Keep up your energy with soup. The salt and nutrients will replenish your electrolytes and the warm steam will help unblock your nose. If you have an appetite for something more substantial, you can add chicken, peas, carrots, and other vegetables to the soup. 6. Avoid food and drinks that contain milk. Milk and other dairy products increase the amount of mucus being created by your body, so try to avoid them as much as you can. These products can be yogurt, cream, butter, margarine, cream cheese. 7. Use steam. Boil a pot of water and then add essential oils like eucalyptus to the water. Put the pot on the table and breathe in the steam. This will relax you, smell good, and help relieve the blockage in your nose. Use a towel to form a tent over your head and the pot. Inhale the steam for at least 10 minutes or until you get relief. Eucalyptus oil can be poisonous, so do not ingest it. 8. Use a vapor rub on your chest when you sleep. This will help keep your nose clear as you lie flat. Apply it to the skin on your chest and inhale the vapor. Always read the instructions on the packaging when applying it. Do not apply it to your nostrils because this puts you at risk of inhaling small droplets into your lungs. 9. Try decongestant medications. These medications can be taken orally or as nasal sprays. They are available over the counter. They should only be used for no longer than a week, after which they can cause inflammation of the tissues in your nose, which will make your symptoms worse. Decongestants are not safe for everyone. Consult your doctor before using them if you are pregnant, or unsure if you are pregnant. Breastfeeding. Treating a child under 12. Diabetic. Or if you have high blood pressure. Hypothyroidism. An enlarged prostate. Liver damage. Kidney or heart problems. Glaucoma. Or you are taking antidepressants that are monoamine oxidase inhibitors. Or taking other medications, even over-the-counter medications or herbal supplements, and you are unsure if they could interact. 10. Gargle with warm salt water. This will be soothing if your throat is sore. The salt may also help fight the infection. Mix at least 1/2 teaspoon of table salt into a glass of warm water until it is completely dissolved and you no longer see it. You can add more salt to make it stronger if you don't mind the taste. Tip your head back and gargle. Children should be supervised during this process so that they do not choke. Try to gargle for about 1 minute. Don't swallow the water when you are done because it has lots of germs from your throat in it, spit it out instead. 11. Ease pain with over-the-counter medications. This will be effective against headaches or joint pain. Commonly used medications include ibuprofen or paracetamol. Consult a doctor before using these medications if you are pregnant or treating a child. Follow your doctor's instructions or the directions on the packaging. Check the ingredients in any other cold medicines you may be taking to make sure they do not contain the same ingredients. If so, do not take them together because this increases your risk of overdosing. Aspirin should not be given to children or teenagers because it is associated with Reyes syndrome. 12. Talk to your doctor before suppressing a cough. Coughing is your body's way of removing pathogens from your airways. Suppressing the cough may be necessary if you can't sleep, but it may make it harder for your body to clear the virus from your system. Do not give cough syrups to children younger than 4. For older children, follow the instructions on the bottle. If there are no instructions specific to your child's age, consult a doctor. 13. Avoid antibiotics. Colds are caused by viruses, not bacteria, so antibiotics will not help. 14. Bring a child with a severe infection to the doctor. The doctor will check to make sure the infection is not something more serious than a common cold. Symptoms to watch out for include a baby under 3 months old with a fever over 100.4 degrees Fahrenheit, or 38 degrees Celsius. Children should be checked by a doctor if they have a fever for more than 3 days. Dehydration. Children that are dehydrated may be tired, urinate infrequently, pass dark or cloudy urine. Vomiting. Abdominal pain. Difficulty staying awake. Headaches. A stiff neck. Problems breathing. Crying for a long time, especially in children that are too young to say what's wrong. Earaches. A cough that doesn't go away. 15. Go to the doctor if you are an adult with a severe infection. Symptoms to watch out for as an adult include fever of 103 degrees Fahrenheit or 39.4 degrees Celsius or higher. Sweating, chills, and coughing up colored mucus. Swollen glands. Extreme sinus pain. Extreme headache. Stiff neck and difficulty breathing. 16. Wash your hands often. Don't touch your eyes, nose, or mouth without washing your hands first. These are all entry points for cold viruses. By washing your hands frequently, you can reduce the amount of viruses on your hands. Rub your hands together with soap under running water for at least 20 seconds. If it is available, use an alcohol-based hand sanitizer. Wash your hands after coughing, sneezing, blowing your nose, or shaking hands with other people. 17. Avoid people who are sick. Try not to shake hands, hug, kiss, or touch people who have symptoms. If possible, disinfect objects like keyboards, door handles, or toys that sick people or children have been touching. You can also limit your exposure to sick people by avoiding crowds. This is particularly true of crowds in small spaces with little air circulation like schools, offices, and public transport. 18. Power up with nutritious food and drink. If you think a cold is coming on, make sure to supply your body with the nutrients it needs to stay healthy and fight off the virus. Eat fruit and vegetables to make sure you get the vitamins you need. Whole grain breads are excellent sources of energy and fiber. Get protein through healthy, low-fat sources such as beans, fish, poultry, and eggs. Avoid eating pre-packaged processed foods. They are likely to have a lot of sugar, salt, and fat. This will make you feel full without providing a balanced diet with the nutrients you need. 19. Develop techniques for coping with stress. Stress causes hormonal and physiological changes in your body which can suppress your immune system and increase your chances of getting an infection. You can cope with stress by exercising daily. This will release endorphins which will improve your mood and help you relax physically and emotionally. Sleep for 8 hours each night. Some adults may need as many as 10 hours. Try to stick to a regular schedule that allows you enough sleep so that you can wake up without being tired in the morning. Meditation, yoga, massage, Having close relationships that provide social support.